Welcome to a new video for the nurses, the most important MCQs. This will be also helpful for those who are preparing for the final exam of NORCET. So without any delay, we can start the questions. Question number 1. While administering medicines, the nurse notes fire in the inpatient area. What is the first priority step by the nurse? Option A, sound the alarm. Option B, call for help. Option C, use fire extinguisher. Option D, rescue the patients. And the answer is option D, rescue the patients. Remember, raise. And the R stands for rescue, A, alarm, C, confine, and E, extinguish. Question number 2. Hand sanitizer kept at the bedside of patients to perform hand hygiene by primary care providers. Which of the Maslow's hierarchy needs is met by this? Option A, physiologic. Option B, safety and security. Option C, self-esteem. And option D, love and belonging. And the answer is safety and security. Remember the Maslow's hierarchy of need. The basic one is biological and physiologic, which include food, water, and sleep. Then the safety, which includes health, finances, and security. After that, love and belonging. Then comes the self-esteem, which includes the respect, strength, recognition, status, and all. Finally, self-actualization. Question number 3. While attending rounds, the nurse saw the physician writing congenital aganglionosis for a newborn with meconium ileus. The nurse knows that aganglionic pathology of large intestine decreasing the GI motility is option A, Crohn's disease, option B, lead pipe colon, option C, Hirschsprung's disease, and option D, intussusception. And the answer is option C, Hirschsprung's disease. Lead pipe colon is ulcerative colitis. Remember, Hirschsprung's disease, also known as congenital aganglionosis or congenital aganglionic megacolon, is nothing but the absence of ganglions in a portion of the large intestine, which results in enlarged colon in that area. That's why the term megacolon. And the distal area you can see little shrunken. And one of the important complications of Hirschsprung's disease is enterocolitis. Question number 4. A patient with aplastic anemia is posted for bone marrow biopsy. While clearing the doubts of the patient, the nurse is aware that the most preferred site of bone marrow biopsy in adults is option A, posterior iliac crust, option B, sternum, option C, anterior iliac crust, option D, vertebrae. And the answer is option A, posterior iliac crust. Remember, the sites of bone marrow aspiration are, the first preferred site is iliac crust or the iliac spine, which is safe, contains large reservoir of bone marrow and causes very less pain. The second site is sternum, but it is considered to be the last resort, also children above 12 years and for adults. Tibia is only an option for infants less than 1 year. And another option is spinous process of lumbar vertebrae. Question number 5. The national program of one of the leading infectious chest disease in India, RNTCP, is replaced by option A, NTCP, option B, NTEP, option C, RNTEP, option D, NMEP. And the answer is option B, NTEP. Remember, RNTCP or Revised National Tuberculosis Control Program is changed to National Tuberculosis Elimination Program or NTEP in the year 2020. Question number 6. The nurse is washing hands before IV injection administration with the awareness that the most important aspect of hand washing is option A, the type of disinfectant, option B, time, option C, surface tension, option D, friction. And the answer is option D, friction. Question number 7. The patient is connected to mechanical ventilator via tracheostomy. The nurse knows that the best way to prevent tracheal dilatation is by option A, suctioning on time, option B, using moist oxygen, option C, tracheal plugging, option D, using minimal cuff leak technique? And the answer is option D, using minimal cuff leak technique. Question number 8. While taking care of ICU patients, the nurse knows that the ideal barrier nursing technique for MRSA patient is. MRSA is methicillin resistant Staphylococcus aureus. Option A, respiratory precautions. Option B, contact precautions. Option C, standard precautions. And option D, enteric precautions. And the answer is contact precautions. Question number 9. Patient in the post-anesthesia care unit with excessive dressing soakage, tachycardia and restlessness is most likely suffering from option A, infection, option B, hyperventilation, option C, hemorrhage, and option D, lymph leak. And the answer is hemorrhage. Always remember, a post-op patient, if suffering from post-op patient or any patients with ectopic rupture or any other internal hemorrhage, if you are suspecting, tachycardia and restlessness will be some earliest manifestation you will find. Once the patient develop hypotension, it is already a late sign, or the patient is about to collapse. Question number 10. A patient admitted in emergency unit with paradoxical respiration. The primary care nurse knows that it is very common in option A, multiple rib fracture, option B, flail chest, option C, cardiac tamponade, option D, atelectasis. So paradoxical respiration is very common in. Answer is option B, flail chest. Remember the difference between flail chest and multiple rib fracture. Adjacent multiple rib fracture is called flail chest. For example, 6, 7 and 8 or 7, 8 and 9 ribs are fractured. You call it flail chest. If the fracture is second and third rib and also then the 11th rib, it is called multiple rib fracture. It is not the adjacent ones. So in adjacent multiple rib fracture only, you can see the paradoxical respiration, which is known as flail chest. Question number 11. While teaching the student nurses in clinical area regarding respiratory system, the nurse mentions that the trachea is lined by option A, stratified squamous epithelium, option B, ciliated pseudostratified columnar epithelium, option C, columnar epithelium, option D, cuboidal stratified epithelium. And the answer is option B, ciliated pseudostratified columnar epithelium, which is lining the trachea. Question number 12. Hormones secreted by human placenta include option A, estrogen and progesterone, option B, relaxin, option C, human chorionic somatomamotropin, option D, all of the above. And the answer is all of the above. Remember, human chorionic somatomamotropin is also known as HPL, which is very commonly known. Question number 13. The Factory Act, which was established in the year 1948, declared which disease as a killer disease? Option A, tuberculosis. Option B, sarcoidosis. Option C, anthracosis. And option D, silicosis. And the answer is silicosis. Remember, silicosis and asbestosis are two major occupational killer disease under Factory Act. Question number 14. While taking care of a patient with cirrhosis of liver, the nurse knows that the most common damage in linaic cirrhosis is due to option A, bile synthesis by liver, option B, excess fat accumulation, option C, filtering the liver, option D, destruction of Kupffer cells. And the answer is option B, excess fat accumulation. Remember, linaic cirrhosis is also known as nutritional cirrhosis or alcoholic cirrhosis, which is caused by chronic alcoholism. In chronic alcoholic pathology of the liver, the main problem or the destruction of the liver or the fibrotic changes of the liver is happening mainly due to excess fat accumulation in the liver. Question number 15. As an ICU nurse, you are aware that the ideal drug of choice for nasal carriers of MRSA is option A, daptomycin, option B, linezolid, option C, mupirocin, option D, vancomycin. And the answer is mupirocin, which is also known as T-backed. Vancomycin or daptomycin are the usual agents of choice for treatment of invasive MRSA infection. And if the patient is resistant to vancomycin, linezolid is preferred. If MRSA decolonization therapy, which includes the intranasal application of antibiotic or antiseptic, we generally use mupirocin or povidone iodine based antiseptics. Question number 16. A patient with drug addiction is admitted in the emergency unit with fever, chest pain and splinter hemorrhage. Also identified road spot and Janeway lesions. The patient is mostly suffering from option A, pericarditis, option B, endocarditis, option C, myocarditis, option D, cardiac tamponade. And the answer is endocarditis. Remember the features of endocarditis. Question number 17. The nurse assesses the patient and finds that the patient is unresponsive with no pulse. The nurse alerts code blue and starts CPR. A rhythm check is performed and PEA is noted with no pulse. What is an incorrect action by the code blue team for treatment of this rhythm? Option A, continue CPR. Option B, administer epinephrine. Option C, defibrillation. Option D, support the airway. And the answer is option C, defibrillation. Remember, PEA or pulseless electrical activity and asystole are non-shockable rhythms. For these two, we should not be giving defibrillation. With that, we complete today. Thank you so much. Have a nice day.